Hello and welcome to the Healthy Living series with Nurse Alice, brought to you by AARP California. I'm so excited to be here with you today to talk about such a very important topic, and that's your blood pressure. Today's program is Know Your Numbers, Managing Blood Pressure with Confidence. And my goal is to leave you with some simple and some practical and some empowering tips so you can take charge of your heart health and your blood pressure. Just a disclaimer that while I am a licensed family nurse practitioner here in the state of California, and while this presentation is based on the latest national guidelines and best practice, the opinions expressed are solely those of mine and not necessarily those of the AARP. So here's our roadmap for today. These are the things that we're going to cover. We're going to talk about, what is a blood pressure, understanding what that means. We'll go over some strategies of things that you can start today. And it'll start from monitoring your blood pressure at home to lifestyle shifts to when do you need to seek help. And then finally, we're going to pull it all together for a pathway moving forward so you can take charge of your blood pressure health. And the goal is to leave you confident and equipped with information and the questions that you need to talk to your healthcare providers about what to do next. So a little bit about myself. I am Alice Benjamin, a family nurse practitioner, and many people know me as Nurse Alice, aka America's favorite nurse. And my lifelong work has been around cardiovascular health, cardiology, emergency medicine, and critical care. I've been in nursing and healthcare for over 25 years. And my mantra is I like to talk to people before they become my patients. And with all of the work that I do, I have been a longtime and proud ambassador with AARP. I'm also the founder of AskNurseAlice.com, an online health and wellness platform, and the host of the Ask Nurse Alice podcast, where everything health takes center stage. So let's first talk about what is blood pressure. It's very important for us to know kind of what is it, how is it measured, what does it mean, so then we can talk about the impact of having high blood pressure and why that's not so good for us. So when we look at blood pressure, it's the force of blood pushing against the walls of our arteries as your heart pumps. So it is the pressure within our cardiovascular system as our heart pumps. And it's measured in two numbers. There's a top number and then there's a bottom number. So that top number, we call that the systolic number. It measures your arterial pressure during a heartbeat, during systole, right? That's why it's called systolic number. So that is the highest number. That's the highest pressure in our cardiovascular system as our heart pumps. And then we have that bottom number, which is the diastolic number. It measures our measures arterial pressure during diastole, between heartbeats, when our hearts relax, when it's filling. So that number is naturally lower than the bottom number. So you have the top number and you have the bottom number. Now, just for purposes right now, if you were saying, Nurse Alice, what is a heart healthy blood pressure? What's goals, right? Hashtag goals. Well, that would be 120 over 80 or less. Not too low, but 120 or 80 over less. Now, that is a number that is set for goals. I understand that some people will have numbers that are lower than that. And then there's some that are higher than that. And so there are a lot of factors that play a role into what is a healthy blood pressure for you, right? So that's why it's important to have a conversation with your healthcare provider, given all the things you got going on, risk factors, other things going on with your health, your lifestyle. What is the goal for you? Now, overall, I'm going to say 120 over 80, right? As close to that as possible. But I understand that some people may not reach this goal, but may come close to it. And the goal is for you to be heart healthy and have a healthy blood pressure. And the reason why having a healthy blood pressure is important is because when blood pressure goes unmanaged, unchecked, or it's elevated for long periods of times, especially when we don't know, we call that the silent killer, right? I know it doesn't sound really good, but the reason why it's called silent is because you can feel fine. You can not have symptoms. You can not know that anything's going on or that you even have high blood pressure because you feel good. And so when that blood pressure starts to rise, especially slowly, your body will adjust to it and you may not feel symptoms, right? You're not going to have that nagging headache or chest pain right away. But there's damage and things that are happening at the cellular level. Whenever there's high blood pressure, that can compromise the amount of oxygen-rich blood that can go to very important and vital organs, and it can lead to serious health problems. So when you see on this picture here, having high blood pressure can increase your risk for stroke. It can increase your risk for blindness, heart attacks, kidney failure, and even heart failure. So it's really important that we know what our blood pressure is. And, as soon as we know it, that it's slightly elevated, then we can do something about it, right? You can't manage what you don't measure. You can't track what you don't trend. And when you know better, you do better, right? When we know these numbers, we have the opportunity to make a change. And it's important that we make this change because there can be some rippling effects here with high blood pressure. And here's an eye-opening fact: nearly half of American adults have high blood pressure. It's actually, according to the CDC, 47.7% exactly of American adults have high blood pressure. And that translates to nearly 120 million people. And that number actually gets higher over the age of 60. And that number then becomes 72% of adults over the age of 60 have high blood pressure. So it's important that we have it under control. And here, only about 1 out of 4 people have it under control. Now, I want you to think of your cardiovascular system and your arteries as a garden hose. What happens when pressure stays too high for too long? Well, when that pressure's high in the water hose, what happens? It's really stiff. There's water just spewing out, spewing out, spewing out, and the hose is very stiff. And it actually kind of narrows and gets really stiff. When the hose is very stiff and the lumen narrows, less blood flow can go out, right? So that's decreased oxygen-rich blood to our organs, like I mentioned on the previous slide. And then eventually, when that hose, over time, the hose can actually weaken or burst. You kind of know, like, I have this water hose that has kind of a little crack, and then you see a little water kind of spewing out the side of it. We don't want that to happen. Things like that can cause things like that when it happens in the body can lead to things like stroke and heart attack. So when we look, I told you what kind of hashtag healthy blood pressure goals are, but let's look at the overall chart here. Let's look at blood pressure categories because there are actually levels to this, right? And this is how we as healthcare professionals uh, diagnose blood pressure and at these different stages. So green go, right? We like that blood pressure, heart healthy, hashtag goals. Now, this might be surprising to some of you because you might say, I've been told this is a normal blood pressure. My blood pressure is 124/79, but I'm told that's normal, that's good. I'm not saying it's bad, but it is elevated. That systolic number, remember, the pressure in our arteries during systole when our heart contracts, it's a little elevated. So we're calling that elevated. It's just the yellow light's like, hey, not bad, but just caution, right? Because the yellow light, you can still drive through a yellow light, but you just got to proceed with caution. You got to look both ways, make sure, cars aren't coming in, those type of things, right? So just be mindful of that. Now, stage 1 hypertension, 130/139. When that top number is within that category, or your bottom number is between 80 and 89, if you meet one or both of those categories, you will be stage 1 hypertension. So if your blood pressure is 132/79, stage 1 hypertension. Or if your blood pressure is 124/89, stage 1 hypertension, because you met one or both of those categories. Now, the next stage 2 hypertension, that's when that top number, that systolic number, is above 140, 140 or higher, or that bottom number, the diastole, this is your heart's relaxed, is 90 or higher. You can meet either both or one or both of those categories. So if your blood pressure is 149/80, stage 2 hypertension. If your blood pressure is 132/94, stage 2 hypertension, because you met that bottom number. Now, these next stages, listen, I don't want you to play with these. These are, I know they might just be numbers on a blood pressure screen, but they mean a lot and potentially can be life-threatening to you if you don't seek attention. So whenever that top number, that systolic number, is a 180 or higher, or that bottom number, the diastole number, is 120 or higher, it is so important that you seek medical advice. Talk to your healthcare professional. So we have that kind of severe hypertension when your numbers are high like that, but maybe you're like, I feel fine. Nothing feels wrong. You still call your doctor, be seen today. You got to get someone to lay some eyeballs on you to know that, like, hey, these are the things that we need to do because we can't leave you that high. We can't leave you at that number. We can't just wait it out. Okay. And then there's hypertensive emergency. Now listen, this is where you call 911. I know. It might be the kid's birthday party, you're on your way to dinner with family, you're celebrating a graduation, but you need to call 911 and be seen by a medical provider immediately. When you're having those high numbers and you're starting to feel symptoms, you have chest pain, shortness of breath, back pain, numbness, weakness, change of vision, or difficulty speaking, go to the emergency room right away, call 911. So it's important to know those categories so we can, it gives you kind of some guidelines of what to do when you don't know what to do, right? Now, how do we even, so before we even get to those categories, I mean, obviously we measure them at your doctor's appointments, in the urgent care, in the emergency room visit and things like that, but you can monitor your blood pressure at home. You can monitor your blood pressure when you go to the CVS and those places that have the kiosks. So you need to check your blood pressure. So first thing is you want to choose a blood pressure monitor. Listen, I have one of these at home. It's battery operated. You have some that are plug-in. Now, listen, the blood pressure machine that you want to use something that says clinically validated, right? When you do take your blood pressure, ideally, you're going to use your upper arms. These provide more accurate readings than the ones that do in your wrist. I know the wrist ones are more convenient, but the more accurate ones will be the ones that are in your arms. You want to consider this cuff size. You want to choose one that fits properly. So I know it comes around with a general adult size, but if you have really tiny arms, you might need more a smaller or pediatric size, or if your arms are bigger, you might need an extra large cuff size. You want to get an appropriate cuff size, because when you don't get the appropriate cuff size, if the cuff's too small, it'll give you a falsely higher blood pressure. If your cuff's too big, it'll give you a falsely low blood pressure. And then I like the ones with digital screens that are large and readable, so it makes it easy for you to read. You're not straining your eyes. So it's important, have a blood pressure machine at home. Now, when it comes to actually taking the blood pressure, once you actually have a blood pressure, there are some steps that you'll need to do just to optimize, to make sure that nothing that you're doing is falsely influencing the blood pressure. So um, you can see there's a picture of me here on the side too. So I have a picture of looks like a healthcare provider taking someone's blood pressure, but I'm not necessarily a fan of this positioning. Is it doable? Yes, but I want you to do best practice when all possible. So first, before you go get your blood pressure, and this is whether you're going to the doctor's office or doing it at home, empty your bladder, empty your body. You want to be relaxed. No caffeine or exercise or smoking 30 minutes prior to taking the blood pressure. And you'll want to sit for 5 minutes, quietly resting, deep breathing before you take your blood pressure. Right? I know that's hard. You get to the doctor's office and they're like, okay, come on back, Mr. Jones. And they're walking you down a long hallway. So you're like trucking down there and you're kind of a little huff and puffing maybe when you sit down, and they want to take your blood pressure right away. They can take it, but then you can ask, or you can ask them saying, you know what, can I just have a few minutes to kind of just get myself, because my heart rate's a little bit up from that little walk, right? But you want to be relaxed when you take the blood pressure. Positioning. You want to sit back in a chair with your feet flat on the floor, back supported. You want to rest your arm on the table. So that's why I'm not a fan of this middle picture per se. The lady's holding her arm, but you see in my picture, I have my arm rested on the exam table. And you want to place the cuff on your bare skin. So they pushed up this lady's sweater, which is okay. Sometimes it can cause constriction. So be mindful when you're going to get your blood pressure taken what you're wearing. But you can see here, I have on short sleeve, it's directly on my skin, bare skin. And so I am relaxed. Okay. Feet flat, back down. I have done some deep breathing. I'm thinking positive thoughts. My arms rested, and I have her take the blood pressure. So that's the best way, an ideal way to do it. And ideally, if you have your choice, left side, because that's the side closest to the heart. But you can do either side. But when you're record keeping, just make notation of which side you're taking your blood pressure on, because sometimes there can be slight differences on the reading on your left side and your right side. Now, when you take your blood pressure, to get into kind of a good practice, you'll want to take maybe at least two, maybe three, not necessarily, 2 or 3 blood pressure readings, but take them 1 to 2 minutes apart. You don't want to take them back to back to back to back, because I just stressed my arm out by squeezing it for the blood pressure. I'm gonna do it right again. My blood pressure is going to be subsequently high. So just take a minute or two before blood pressure readings, and you'll want to record all values, the time of day in which you took it, and the side in which you took it. So you want to monitor consistently on a particular arm. So here are some common mistakes that people make when they're taking their blood pressure. And listen, we're in a rush. We're getting it done. Sometimes we feel like we're not on someone else's schedule, like the doctor's schedule, right, or the medical assistant schedule. I'll say this, if you go and if she wants to take, he or she wants to take your blood pressure, that's fine. And if it's a little bit elevated, or the doctor comes in and you see, white coat syndrome, blood pressure goes up and it's a little bit high. After you've had your visit, you've gone through some things, you're a little bit more relaxed, ask them, can we repeat that blood pressure? I just want to make sure, just double check. 'Cause I think I was a little nervous or scared when I took it initially. And that's fine. But so timing can be influence on your blood pressure. Incorrect positioning. Don't cross your legs. Holding your arm up while they take it, that stresses your arm. That can increase the blood pressure. Um, Having your arm either below heart level or not. We don't really take our blood pressure above heart level, but if your arm is just hanging straight down, that can increase that can alter the blood pressure reading. Wrong size. You got to have your right size. Okay. Again, too small of a cuff, high blood pressure. Too large of a cuff, falsely low blood pressure. And then switching arms, inconsistency and the times of the day. So sometimes people have higher blood pressures or certain times in the days, and that might be associated to lifestyle activities or timing of medication. So when you take your blood pressure, always keep track of the time. That way we can track and trend. Are there patterns throughout the day that we might be aware of or need to know? And so any of these mistakes can actually change the your readings by up to 10 points. So that's of significance, right? There's a big difference between 120 and 130, right? 150 and 160. I mean, also it's high, but still, listen, I don't want my blood pressure any higher than what it really needs to be healthy. And also, we want to shift our mindset to this. When we look at our blood pressure, it's a number, we're chasing it, right? Like we often do, like the numbers on the scale. And sometimes that can be stressful and lead to high blood pressure. So I want us to shift our mindset. We are not striving for perfection, we are striving for progress. Health is very personal. This can be very scary sometimes. And I never want and I've never met a person who says, I want high blood pressure. No, not that, right? And so some people think like, oh, well, to have a better blood pressure, I gotta let go of this. I can't do this. I can't. It's not about restriction. It's about empowering you with information so you can make different choices. Every healthy choice is a gift to yourself. It is the gift of life. So we would forget about perfection. We want to celebrate progress. And instead of fearing the numbers that are on your screen, I want you to learn from them. Use them as information, use them as knowledge. If the number reading is high, it's like, why is it high? Am I worried about something? Am I stressed about something? How have I been treating myself? How have I been treating my vessel here? Um, because it's not about managing a disease. It's really about supporting your heart and your heart health. You want to live a happier and healthier life. So how can I do that? So we want to pivot, switch that mindset from fear to knowledge and empowerment. So, and sometimes it takes a little woosah right there. Yes. So now we're going to get into some lifestyles and some tactics and things you can do to kind of manage our blood pressure here. And listen, I know there's lots of different diets out there, but I'm just going to go over the DASH diet approach. Okay. Dietary approaches to stopping hypertension. That's the DASH, right? And eating this has been clinically proven to improve and lower your blood pressure. So here are the recommendations for that diet, right? The servings, 4 to 5 servings of fruits and veggies, nuts and seeds, 4 to 5 servings weekly, whole grains, 6 to 8 servings daily, lean proteins, chicken, fish, lean meats, and then also low fat dairy, 2 to 3 servings daily. Now, before anyone tells me like, oh, Nurse Alice, I'm lactose intolerant, I can't have that. There are other things that you can eat for dairy things. And so if you are someone who is lactose intolerant, so I got something for you. I want you to think of fortified non-dairy alternatives like almond milk, soy milk, oat milk, lactose-free cow's milk, but making sure that they are low in saturated fat and that they are also fortified with calcium and vitamin D, since those are the nutrients that can help us support blood pressure control. So these are some things. Now you got to play with this diet, find what tastes good to you. And I know, well, let me just say this: we were not born craving sweet or salty things. That was an acquired taste. So just as much as you feel like, oh, I gotta salt my food before I eat it. Do you really? Let's try it. And then maybe when you taste it, it's like, you know what? I don't need as much salt, or perhaps you can find an alternative. But I want you to focus on trying to incorporate more of these healthier alternatives into your diet and taking out some that maybe, okay, that didn't really fit the list. But we want to take this approach because food is medicine. We are what we eat. I know not literally like I eat chicken, don't make me a chicken, but what I take in that nourishes and feeds my cells. So if I feed my cells unhealthy food, sugary, salty things, alcohol, things that are damaging, how do I expect those cells to function? So it's very important that we look at the DASH diet approach and incorporate some of these other healthy foods. Um, Now, simple food swaps. You can get with this or you can get with that, right? Let's get with that. Let's try some alternatives here. So I know people like to salt their food for flavoring. Well, instead, maybe try some herbs, some spices, or some citrus. You'll be surprised what a squeeze of lemon or a little Mrs. Dash can do. Okay. Um, I like canned soup. I like a little chicken noodle soup, especially when I'm under the weather. But let's try some low sodium homemade soup. Okay. Instead of white bread, maybe some whole grain bread. Um, I like fried chicken, I do. But maybe let's try some baked chicken or some skinless chicken. Or how about this? I got two pieces of fried chicken. I'm gonna take the skin off of one of them and then eat the other one. So eat the skinless one first so you can savor the last one with the fried on it. But these are alternatives. And I'm being realistic. You might think I'm being funny or being silly, but I'm actually being realistic because this doesn't work if you don't do it. So I want you to be, every little step is a milestone, actually. So every little change over days, over weeks, over months makes a big difference. Ice cream. I like ice cream. And you can say, oh, there's my calcium, there's Alice. Yes, I know. But let's do this in moderation and maybe let's try some Greek yogurt with fruit. That's a nice alternative if you're having a little bit of a sweet tooth. Instead of potato chips, because they say Lay's, you can't have more, you can't have just one. That's because it's chemically engineered to do that, just FYI, so you know. Let's switch to some unsalted nuts or air popped popcorn. We used to do that back in the days. I know people just stuff in the microwave, but when I was a little girl, my mom would air pop it on the stove. So you could really be in control of how much salt and butter you put on there. But as we're talking about swaps, really we're talking about salt here, sodium. And so the goal is to have less than 23 milligrams, that's about a teaspoon of salt, which that can lower your blood pressure 2 to 8 points. Now, if you're someone who already has high blood pressure, especially if you're on medication, the American Heart Association recommends having a limit of 1,500 milligrams of salt per day. So um, if you could bring down your salt intake, who knows, work with your healthcare provider, you may be able to minimize some of the blood pressure medications that you are taking. That's also movement. I know I said food is medicine. Movement is medicine as well. Regular activity. Move, 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 right? Regular activity strengthens your heart and helps it pump efficiently, so that we can bring down the pressures in our arterial walls as our heart is pumping. Now, listen, I've been always asked, where's Alice? What's the best exercise I can do? The one you're going to do. Because if I give you a list and you're not going to do them, what good does that do? So we want you to find an activity that you enjoy doing, as long as it's movement. For some, it could be walking. Aim to walk 30 minutes a day. You can divide it up 10 minutes in the morning, 10 minutes at lunch, 10 minutes after dinner. That's a good one, right? And actually, you'll find out you'll start walking more. So you actually might get in more than 30 minutes a day. And then actually walking after meals is actually a really good activity. Helps with digestion and a lot of other things. So just FYI. So there's walking, there's dancing, right? Now listen, and everybody's doing that Chris Brown dance, right? And I don't know how to do it, but listen, try. Try to do a dance. Get moving. Find your favorite song and just get when you're in the kitchen, cooking, dance a little bit. When you're watching television or you're walking around the house, just dance a little bit. Movement, get your heart rate up. It puts you in a good mood and it has such positive effects. And then let's not forget stretching, right? Stretching is important for balance and flexibility. So while I'm thinking about walking and movement, let's not forget about stretching. I did include weightlifting in here, but weightlifting is also something that resistance exercise is also important. But movement, just getting moving, getting that heart rate pumping and flowing, that is what you need to do to help lower down your blood pressure. And now you're gonna say, like, well, exercise and raises my blood pressure. Well, momentarily, because you're stressing the body, you are stressing the body with activity, but you're training the body how to handle stress response without having to be so high. So once the heart kind of gets conditioned, like, oh, okay, exercise, I don't need to work so hard. I don't need to increase the blood pressure so high. Then over time, your blood pressure actually will lower. So that's a good thing. Now, what are some things we can do beyond exercise, right? There are definitely some things we can do beyond diet and exercise. But I'll say this, as a healthcare professional, you come in, we're going to talk about blood pressure. It's a little bit elevated. You're going to say, Nurse Alice, what can I do? I'm going to say the first things that we can do that don't require a prescription from me are changing what you eat, right? Some diet modification and exercise. Now, I'll write it on a prescription pad if you want me to, but you don't need a prescription from me to do those things. So those are well within your control, right? You got this. You can do this. Now, there are some things that are beyond diet and exercise. Still don't need an order from me as a healthcare provider that are in your control. At least you might need a little help, but initially you don't. Stress management, woosah, woosah. We got stress is everywhere. You see everything that's going on in our nation today, all the injustices, things that are changing. It just lot the stress around us at work, personal, with our kids, with so many different things not going the way we want to, relationship didn't work, got a medical diagnosis you didn't really want to hear, right? But stress keeps our body in that fight or flight mode, and in that there's a release of cortisol and other stress hormones. Listen, I'm not saying you can control the stress that's happening in your life, but you can be better at how you manage it. I promise you can. It may not feel like it, but I want to empower you and tell you today that you can. So, one of the things that I do is I look for gratitude, right? I look for the lesson. I look for the blessing and everything. So, like, and some people are, and for some that might be more faith based, and that's okay, right? Whatever works for you. For myself, what I'll do is like, you know what, Lord, thank you. I don't know what's happening with these kids right now. I know he's cutting up and thinks he knows everything, but thank you for my child. Thank you for this teenager. And thank you for blessing me with a healthy son. He's acting a little crazy right now, but he's healthy. And I know you're going to send him on the right path. And I know for you, like, Alice, that's not really going to help. For me, it'll differ on the person, but I do that. And listen, I am woosahing, I am taking deep breaths. I am also meditating and I'm journaling. I have my journal. I don't have my journal right next to me, but I literally have a journal and I write down things to help me manage my stress, to kind of get it out. I also get out into the garden, put my feet on the ground so I'm grounded, my toes touching the grass, getting fresh air. I do things to manage my stress. I learned how to say no. No is a complete sentence. Alice, can you take on this activity? No, thank you. No. So stress manage, whatever you have to do to manage your stress, right? Sometimes it's removing yourself from situations and placing yourself in more peaceful situations. Smoking, limit smoking. Smoking is a leading cause of preventable death when it comes to heart disease. Lowering your blood pressure, even if you've been smoking 20 years, if you stop today, your blood pressure can improve in the next couple of weeks. And even exposure to secondhand smoke, limit that, right? If you have friends that smoke, you might want to steer clear of that during their smoking times. And listen, smoking is linked to about a third of deaths from heart disease and 90% of lung cancer. So there are so many benefits from limiting your smoking. Also, limiting alcohol. Now, listen, I'm not saying don't celebrate with an adult beverage, but I do like a mocktail, right? I do like a virgin something to drink, right? And that's just because alcohol can increase the levels of hormones that can constrict your blood pressure, or excuse me, constrict your blood vessels, which increase your blood pressure. And that can also lead to also reduce urinary output. When you have alcohol, it can cause your body to think like, oh, I'm dehydrated, and you hold on to fluids, which can also increase your blood pressure. So those who are water pills really know what I'm talking about here. But you'll want to limit your alcohol to 1 drink a daily for women, 2 for men. I do not advise drinking every day. I will say that. And definitely avoid binge drinking. But long-term heavy drinking can damage your blood vessels, weaken your heart muscles, cause problems for your livers, your vision, your mentation, so many different things. So limiting alcohol is extremely important when it comes to managing your blood pressure and your overall health. Now let's talk about cholesterol, right? These are some guidelines, right? Now, did you know that your body makes its own cholesterol? It makes what you need. So we go overboard when we consume extra cholesterol in the foods and choices that we eat, the fatty French fried foods that seem to taste so delicious, but can cause a lot of long-term damage if we don't modify our eating pattern. So when there's too much cholesterol in the blood, it can increase your risk of heart disease and stroke. It can actually lead to atherosclerosis, which is the plaque buildup against the walls, which narrow the blood vessels. Again, narrowing the lumen of the blood vessels leads to high blood pressure. So every step counts. We need to protect our arteries so you can take action. Now, here's a guideline here about what your cholesterol levels are. So the next time you get your cholesterol levels, although your provider will talk to you about them, right next to this list and see where you stand. Like, okay, my total cholesterol is less than 200. That's good. It decreases my risk of heart disease. My LDL, the bad cholesterol, less than 130, good. Keeps me at the low risk for heart disease. My HDL, that's the good blood pressure, good cholesterol. Think H, happy, 60 or higher. That's the only cholesterol we want high. Okay, the only one. And then triglycerides. Okay, my glycerides are 147. Good. I'm at low risk for heart disease. Now you can see the higher the number gets, the higher your risk for heart disease. So you want to take action. Talk to your healthcare provider about it. Take medications that you're prescribed. Maybe you have some cholesterol medications, right? Making healthier food choices, opting for baked versus fried, limiting those trans fats and saturated foods from your diet, avoiding nicotine. So that might be smoking, that might be chewing, tobacco, those type of things. Stop smoking and stop smoking. It actually lowers your good cholesterol. Did you know that? And then getting active, getting moving. So managing your blood sugars. This is also something that's important. When your blood sugar stays high, it actually can damage the blood vessels in your arteries, making them stiffer. And when it does that, it can increase the blood pressure. And when glucose, blood sugars levels are high, I want you to just visualize pancake syrup, right? You know the consistency of pancake syrup. Well, your blood should flow like water. But if your sugars are too high, it'll flow like pancake syrup. Limiting oxygen-rich blood getting to important organs and cells, and limiting the removal of waste. Okay. So did you know that having high blood pressure, excuse me, having high blood sugars can put you at increased risk for heart disease and stroke because of those things. So it's important to get screened for diabetes. So make your appointment, get screened for diabetes, and know what your A1C levels are. A1C levels, a 90-day average of what your blood glucose levels have been over the last 90 days. When you take the blood sugar, like you see in this picture, that's a moment in time. Now, if we have enough of these moments in times, we can, and when you've eaten, we can also use that to guide us if you're pre-diabetic or if you have diabetes. But in overall general, knowing what your A1C is most helpful. So having a goal of less than 5.7, that means you are non-diabetic. Now, if it's a little bit elevated than that, it can lead to pre-diabetes or diabetes. Exercising regularly burns off that sugar, and maintaining a healthy weight and avoiding nicotine products. These can help manage your blood sugar level. So when you can do this over time, you significantly not only minimize your risk of stroke, heart attack, and kidney disease, but it helps to maintain a heart healthy blood pressure. Now let's get to this one because everybody wants to talk about weight, right? And I know I'm going to mention it. I know what you want to hear about. You want to hear about the weight loss injectables, but first, let's talk about weight. Right, the way we measure weight obviously is getting on a scale, but sometimes we also look at your BMI. This is a numerical value of your weight in relation to your height. So I understand this is not the most perfect way of calculating your BMI. There's actually physical ways we measure parts of your body, and there's all these calculations. But the easy way and the way that you can do it, you can find these calculators online. Put in your height, put in your weight, and it'll give you your BMI. And I'll say insurance often uses these for several things. And so since this is commonly used, it's good to know what it is. Having a BMI less than 24.9 is optimal for cardiovascular health, right? You can see when you put your height and the weight in there, if you start to trickle into a BMI of over 25, up to 29.9, you're overweight, greater than 30 obese, greater than 40 morbidly obese. So it's important that you take action. Having more weight means more work for your heart. Imagine carrying a backpack every day and your heart has to pump harder to circulate blood because of the extra work that it has to do from carrying the extra weight. Well, sometimes that weight isn't a backpack, it's kind of around here. And I've had it. Listen, I've had it. So let me be the first to be transparent. I used to weigh 185 pounds at one point. It was probably one of the most unhealthiest times of my life. I was borderline diabetic. My cholesterol levels were up there. Had like elevated blood pressure. My skin was oily. I just didn't feel good about myself. I feel like I was depressed. I just didn't feel good about myself. So actually losing weight helped with all of those things. It really did. It brought all those numbers down. I started to feel better, look better, all of those things. It's also important to know that having extra fat, especially around that midsection, triggers our hormones to hold on to more water, hold on to more sodium, which can also drive your blood pressure up. And obesity is linked to insulin resistance. So connection between diabetes and being overweight. So the good news is you can lose weight, right? If you can lose 5 to 10% of your body weight, that can significantly improve your blood pressure, improve your cholesterol, and reduce your risk for diabetes. And I have some pictures of some folks up here. Um, some familiar faces, you know them, and you can kind of see some of the before and after. Now, and I don't have my before and after, but again, I went from like 185 is I was struggling. I had some 18 jeans, and I had to jump up and down to kind of fall into them. Those were not the best times. And for those of you who are there, I can relate to what you're going through. Nobody really wants to struggle with weight loss. We want to lose weight. We want to be healthy. I understand. And so some things you need to do is to take action. First, know your BMI. Now, we also have to be smart about what we're eating, the calories that we're consuming, and the calories that we are burning. So that's, remember when I said diet and exercise, first two things we need to do. That's where we can start. Now I know it's going to be hard for some of us because we might have a joints problems or back problems. I can't move as much, or I'm bound to a wheelchair, or I use a walker, or you know what, I'm in perimenopausal stage, or I'm menopause and my hormones are working against me here, right? Or I'm feeling kind of weak because I just went through a bout of chemo treatment. There are some challenges, that there are some things, some obstacles, some road bumps that will get in our way of losing weight, but there is help, and that's where some of those weight loss injectables come in. Obviously, you talk to your healthcare provider to see if this is an option for you. um, but the things that you can do without the prescription, and from what I already mentioned, is also keeping a journal. When we know what we're eating, when we know what we're doing or not doing, then we can hold ourselves accountable. Like, oh, okay, Alice, you did that. That was you. Let's do better. When you know better, you can do better. And just be careful also of those skinny teas, the things you wrap around your waist that tighten you up. Those are not going to cause you to lose weight. They might aesthetically look like you look snatched around the waist for a minute because you wore a waist trainer, but it doesn't do anything for weight. Maybe some good back support for a while, but there's some real things that you can do. Diet, exercise, actually managing your stress. Is also helpful. And then talking to your healthcare provider to see if weight loss injectables might be an option for you. And there's something that's here not on the slide, but I'm going to get into it in the next one, is sleep. Sleep can also help you sleep your way into losing weight. And I'm going to tell you how you can do it. But let's get on a weight loss plan. Okay. Weight loss plan will lower your blood pressure. And like I said, will do all those other things for your diabetes, your cholesterol. You'll feel better. All of these things. But definitely, even with the weight loss injectable, you still got to do the work. Still got to decrease the calories that you're consuming and increase the calories that you're burning. Okay. So sleep, this is where I wanted to talk about. So sleep quality is definitely linked to higher blood pressure. So as an adult, now if you don't get this amount of sleep, I want to encourage you to look at your sleep patterns, because people are like, oh, I'm fine with 4 hours of sleep. You might think you're fine with 4 hours of sleep, but I don't know that your cells and your organs are really happy with 4 hours of sleep, right? There has to be a reason why you feel satisfied. And that could be that you've become comfortable with a sleep deficit over time, but your body is working overtime. In order to be healthy, if you're eating and exercising the way that you should, if you're managing stress, you should be able to relax and go to sleep. Because is it stress that's keeping you up? You know, or are you, maybe you're smoking and drinking, and those are interfering with your sleep patterns. Like there may be something interfering with your sleep if you're not getting 7 to 8 hours of sleep. Listen, I love me some sleep. I do. I really, really do. We go together real bad. And so I aim for 7 to 8 hours of sleep every night, and I get it. Because listen, no one's gonna stress me out of into a short life. No one's gonna stress me into a heart attack. I'm gonna get some sleep because my body needs to reset. It needs to rest, digest, and reset. And if I don't get sleep, I won't be able to do it. So many people are sleep deprived and don't even know it. And that sleep deprivation can slow your metabolism. So it makes it harder for you to lose weight. Um, Also, it's associated, sleep deprivation is associated with not wanting to exercise, because you're going to not get enough sleep and you're going to think you're okay. But then you're like, oh, I don't feel like exercise, but maybe you're just too tired. You don't have the energy to do it. Right. And then also, not getting enough sleep impacts your stress hormones, increased cortisol, increases blood pressure, increases blood sugar, all those type of things. It weakens your immune system, right? Who knew that? Like, when you If you're getting frequent cold, maybe you're not getting enough sleep, right? That might be one of the things. It influences your breathing, your mental status as well. And then let me say this about when I said sleep your way into losing weight. While you sleep, there are hormones leptin and ghrelin. Those are regulated only during sleep. If you don't get enough sleep, they become dysregulated. And those are the hormones that are responsible for satiety, meaning I feel full and satisfied with what I just ate, and they control the munchies. So when you don't get enough sleep and those hormones are dysregulated, you're never going to feel satisfied and you're always going to have the munchies. So sleep not only helps with blood pressure, helps with losing weight, helps with your blood sugar. Like, who knew? Who knew? And listen, do I need to write a prescription? Oh, I don't. Look how empowered you are. You got this. You can diet, you can exercise, you can sleep, all that to help improve your health. And I haven't even written a prescription. Look at you. No copay. Now, when to seek medical attention, we talked about that slide previously of what the numbers were. Let me reiterate, because I want you to seek help right away. Don't wait till the vacation's over. Don't, well, when I get off of work, I'm gonna do this. You might not make it to when you get off of work. Reading, blood pressure, 180 or greater for top number, 120 or greater on the low number. Hypertensive, emergency, urgency. You may be having symptoms, you may not be having symptoms, but that number, you need to seek medical help, right? Please, please do. You have severe headaches or vision changes. Now, this can often be a late sign of high blood pressure. Remember, high blood pressure is a silent killer. Blood pressure will rise and rise. And you're no symptoms. So by the time you get to a headache like this and you have a high blood pressure, baby, go to the be seen. Okay. Chest pain and shortness of breath, absolutely go. Don't sit there and just try to let me drink some water and think it'll go away. No, no, no. Chest pain, shortness of breath, gotta go. Severe anxiety or confusion, especially if it's acute and it's not normal, absolutely go. Whenever you see blood in your urine, unless you are menstruating or you are like maybe on antibiotics recovering from urinary tract infection, or there's some rationale, some medically documented rationale as to why you have blood in your urine and it's actually on the mend, you absolutely need to go. That could be a sign of some type of cardiovascular issue going on. It could be a sign of cancer. It could be a sign of so many different things. But seek medical help, because I can't tell you what blood in urine just means independently of itself. But usually it's not a good sign. Okay. And then any difficulty speaking. That can be a sign of a stroke. Blood pressure. And listen, your blood pressure does not have to reach the 180 over 120 levels to be harmful, right? We saw what a heart healthy 120 over 80 blood pressure goal is. We get a little bit elevated, get a little bit elevated. So it went from kind of green to yellow to orange to red. Your numbers don't have to be in the red for damage to happen. There are people who've had heart attacks in the orange stage, right? Blood pressure's 130 over 94. You think like, oh, it's a little bit elevated. It's not like in the red. It can cause damage. So we don't treat numbers, we treat patients. These numbers are guidelines to help effort. They help clinically advise us and help empower you some information. But when you have symptoms, right? When you have symptoms, these symptoms will trump your blood pressure readings, right? So this first one, the 180 over 120, if you don't have symptoms, but you have those numbers, you still got to go. But if you have these symptoms and your blood pressure, it doesn't have to be in the red. It can be like in the yellow or the orange. I still want you to go. So these are times where you need to contact your doctor when your blood pressure is consistently high. Um, or maybe you're on blood pressure medication, but you're having side effects from them, and so you haven't been taking them. And we got to figure that out. We can't let you not take your medications, but need the medications, right? Maybe if you're pregnant, there are new guidelines, 2025 guidelines for pregnant women and for those postpartum in first year. If you are pregnant or postpartum, the elevated numbers are actually more stringent. So you can have a 140 over 90, but if you're pregnant postpartum, that actually may be more dangerous in you versus a regular person who's not pregnant or postpartum. So I want you to get those checked out. And then sometimes you need some medication adjustments. Maybe you're on blood pressure medications, but they're not touching it, or it's not working as well as it used to. Or it could be the opposite. Your blood pressure is like, oh my gosh, this is too low, right? And I don't need to take, but you're still taking your blood pressure medications because we told you take your blood pressure medications. But if your blood pressure is too low, got to be mindful of when and when not to take your blood pressure medication. So you got to talk to your doctor or your healthcare provider, like nurse practitioner. Um, and having a medication tool, reminders. Needing medication is not a failure. It's a tool. right? It's a tool in your toolkit. And sometimes changes are needed. You might start on one particular medication, dose might need to change, or you might need to be placed on a combo medication. Sometimes there are certain combinations that work better than others, but work with your provider to find out which one works for you. Take them as prescribed. And if you're having some questions about, do I need to take it, or maybe my blood pressure is a little bit low, or are these kind of off scenarios, please ask. Call your office and ask. Don't skip doses. Um, and listen, if you're traveling, make sure you carry enough medication with you, 1 to 2 weeks with you. Make sure you have an organizer, or you have a regimen or routine. Because I don't want you going around like, oh, it's 10 o'clock. Did I take my medication? I can't remember. Because it's just a bottle there and you don't know if you opened it or not. We don't want you to double dose and we don't want you to miss it. So sometimes sometimes there are pill dispensers that you can take. And if you're having any side effects from your medications, and listen, you may not know that this is a side effect from your medication, but you feel something that's a little different. Maybe related to the medication, maybe not. But still, talk to your healthcare provider and ask the question to find out. Maybe it's two totally separated incidences. Maybe it's related, but it's important to know because these side effects may be tolerable. Maybe they can go with a dose adjustment or a medication change. But we want you to take your blood pressure medication as prescribed to keep your blood pressure in a heart healthy range. But we want to provide you with tools and tips to make sure that it's safe. Now, here's where you create your personal plan. You want to start with something sustainable, small, and something that you can maintain, right? Nurse Alice, what's the best exercise I could do? The one you're going to do, right? What's the best, you know, source of calcium? The one that you're going to want to eat because it tastes good to you. So here you go. For when you create your personal plan, start with a week plan, right? Maybe establish your blood pressure, incorporating some healthy foods into your diet, and just ease into the exercise if you don't already do it, right? And then over the next month, start to do more, start to familiarize yourselves with reading food labels and sodium that's on there, increase your walk length time, and then really incorporate some deep breathing exercise in your routine. Maybe you wake up, go to the bathroom, do your business, then you come back after you fixed your bed and kind of just sit there and relax at the edge of your bed, prayer, meditation, but just some relaxing, giving some gratitude, getting that mindset together for a happier, healthier life. And then over the next 3 months, now you're in it. Like, hey, I got some routine, I got some swag, I got some skin in the game. I've been doing good, Nurse Alice. I love it. Track your patterns. Track your patterns and make sure that remember, we can't track what we don't. We can't trend what we don't track, and we can't manage what we don't monitor. So keep those readings, keep it, your activities, what you've been eating, blood pressure readings, bring all that to your healthcare provider and share your successes and see like, oh, wow, you know what, you've been doing so well. Maybe we can ease up. Instead of taking this twice a day, we can do it once a day. Let's try that. Or maybe we can come down on a dose, right? Sometimes that happens. Sometimes it doesn't, but sometimes it does happen. And that's a great thing. People have asked me, can I do these things and probably get off of medication? It is indeed possible. It is indeed possible. I've had patients where that's happened. I've had them decrease their medications, and that's a beautiful thing, doing it the most natural way. Now, it takes some work. You got to be consistent. Okay. Taking a medication is easy. And really that's only a tool. You're still supposed to do the other things, right? But when you can take charge of your health, it feels so good inside. I want to empower you. You have the control to do, to diet, to exercise, meditation, to stop smoking, to stop drinking, to be better stewards of your health. Shift that mindset into something positive. This is all part of creating your personal plan. I'm your healthcare provider. I'm going to work with you. I want to hear all the wins. I want to hear the challenges, and I want to work with you on a plan so you can be successful and we can do this together. But I want to empower you that when the coach is not on the floor, you, the player, get in that game, do your best, give it your all, because really, you are leading this course here. So I did mention tracking your progress. How do I do that? Now be mindful. Don't just write it on little napkins or pieces of paper. Get a journal, get a book, and then you take this book with you every time you go to the provider's office, and also write your notes and other medical things. And then if something's going on with you, your family also knows, like, oh, there's granddad's um, blood pressure reading book, or his health book that he takes to all the appointments. It's a source of information where people can go to get all that. Now you can do it digitally, or you can do it paper options. Pick the one that works best for you. Now, if you do it electronically, it's easier to share with providers. A lot of our providers now, you can share electronically that information. But if you're someone who likes to still pen and paper, which I still am, please, by all means, have your book, but also designate a place for it and let your family and your friends know where that lives. So some key takeaways, guys, here. Blood pressure is a silent indicator of heart health. Be mindful of that. You know, when it says, like, no news is good news, we like to think that until we get the news and like, oh, why didn't you tell me sooner, right? Well, we can't trend what we don't track, and we can't manage what we don't monitor. Know your numbers, know what those mean. I've given you those charts. So you have some guidelines there. So you can kind of like, oh, well, this particular reading falls into this category. Share that with your healthcare provider. And understand, you are in complete control of your diet, your exercise, stress management, sleep. All those things matter, right? Someone might say, oh, well, that little thing doesn't matter. And that little thing doesn't matter. But if I take a whole bunch of little things and I put it in my basket will overflow. So those small, consistent changes do mean something. They matter. They matter every day, every week, over months, over years. They matter, and they will make a difference. And then partner with your healthcare provider. I'm Nurse Alice. You know, although we don't haven't established a patient provider relationship, I'm here to empower you with information, things that you can talk to your healthcare provider with, so you can get the information you need, ask the questions you need to ask, and better understand what's going on with your health. Because not knowing can instill fear and confusion. And you and your healthcare provider should be like this. You guys are besties. You go together real bad. And so you're partners in this. So partners talk. So talk to your healthcare provider, what's going on, let them know, be honest, be transparent, and also ask them, give it to me straight, be transparent. Because some healthcare providers can sometimes be more too gentle in their approach of what the long-term effects are, and some are too blunt. It's like dating, finding your person. Find your provider that communicates with you and doesn't make you feel like a burden or feel like you can't tell them anything. That's really, really important. So your heart health journey continues. So I want you to take all this information we talked about today, um, implement it. If you have questions, you need to go back and watch the replay, talk to your healthcare provider, share this with your community, your church, your classmates, your coworkers, because we're all in this together. We need community to help hold us accountable. Support is needed, whether it's support of your family, your friends, your provider. We're here to help. I'm here to help you. AARP is here to help you continue your heart health journey, which is why we're doing a series, Healthy Living here with Nurse Alice. And so these are some of your first steps that you could take to help manage your blood pressure. So I want to thank you so much for joining us today. I want to invite you to please sign up for more events at aarp.org/California, CA, and then also invite you to our next presentation, Protecting Your Senses as You Age. Learn how to spot early changes in vision and hearing, explore tools and strategies to protect your senses, and stay independent and connected as you age. I'm Alice Benjamin. It has been my extreme delight to be here and to talk to you as friends and not as a patient about high blood pressure strategies and things that you can do to take charge and control of your health. And hope I've empowered you with information. If you have any questions, please feel free to contact me at info@asknursealice.com or visit my website, asknursealice.com. But again, please visit AARP's website. We have a series of videos, healthy living series with Nurse Alice, as well as a lot of other great information on health and wellness on AARP. So thank you so much for your time. So until next time, please make good choices, be kind to one another, and live well, my friends. Talk to you soon.